Welcome to Knowledge on the Go, the podcast brought to you by the PI Programs team at Vizient. I'm Amber Hanser, Senior Performance Improvement Program Director here at Vizient, and your host for today's episode. Hospitals are in the business of improving care and want to keep their patients safe while also having a satisfied workforce. More creative staffing models are emerging, and hospitals are focusing on more advanced training of their non-licensed personnel. Nurses have the capability and responsibility to delegate. However, we must help remove their fear of delegation to allow our nursing staff to work at the highest level of their education, license, and experience. Today, we'll examine what organizations should consider when developing nurse delegation training. We'll discuss leadership's responsibility and support in encouraging relationship building, developing trust, and effective communication between their nursing staff and patient care technicians, or PCTs. Joining me to discuss this is Michelle Davis, Assistant Vice President of Medical Services at Unity Health. Michelle, welcome to the podcast.
Thank you, Amber, for this opportunity. It's a pleasure to be joining you today.
Absolutely. We're excited to have you. Please tell us a little bit about your role at Unity Health and your passion for this topic.
Sure. I'm over the inpatient side of nursing operations, and that consists of 11 areas of oversight, such as our CCU, our progressive care unit, post-op, and other medical units. I have 7 direct reports and approximately 370 indirect reports. And this topic is important to me because I'm very passionate about providing quality patient care as well as supporting our clinical staff. And this project enabled me to meet both of these goals.
And in supporting your clinical staff, help us understand what kind of education or training the Unity Health nurses receive on delegation.
Our delegation training was an 8-hour session taught by our education department. In this training, we define delegation and we discuss the components within the delegation, such as the evaluation of patient needs, their conditions, the stability of the patient. We also wanted to examine the complexity of tasks that we want to accomplish during a given shift. We discuss how to ascertain the skill level of the patient care tech. Are they an experienced tech, or have they just recently passed their competencies? We discuss the importance of clear, precise instructions and any associated timeframes. We really stress communication. You cannot over-communicate. We talk about the need to recognize teaching opportunities and for our nurses to take advantage of those opportunities to build our patient care techs up. We discuss the need for reevaluation throughout the day and telling the nurses that it's okay to change your mind. You can remove a task that has been previously delegated at any point throughout the day. That is completely within your judgment. And lastly, we want to show them how we determined what tasks could be delegated because we want them to have confidence in our program. So we relied on our Nurse Practice Act, the Arkansas State Board of Nursing rules, our hospital policies, and then specific training and competency checklists. And we do all this so that the nurses are confident that we're following the rules handed down by our state nursing board.
Michelle, that sounds extremely comprehensive, right? Lots of different areas, lots of things to consider when developing this training. Tell us, what was one of the easiest or one of the most difficult things when putting this delegation training program together?
Well, the easiest part of the project was obtaining the nurse aid buy-in. We use this as an opportunity to develop a clinical ladder for our nursing aides to advance within the organization. And they are so eager to learn new skills. And they've reported to me that they feel more valued because we're investing into them. The most difficult part of the project was making sure that we had job descriptions in place that aligned with our hospital policies, that we obtained nurse buy-in, and that getting everyone their delegation training. We felt that it was important to conduct in-person training sessions so that the nurses could express any questions or concerns that they might have prior to us implementing this project.
And kind of with that, expressing their concerns along the lines of communication. And you had kind of mentioned the importance that you can't over-communicate. So what role do you find that communication plays in successful task delegation?
Yeah, communication is the key to the success of a delegation process. The nurses must communicate with the patient care tech to determine their skill levels, to build that trusting relationship between both individuals. And then by communicating, each team member will have the ability to anticipate each other's needs and perform more efficient patient care.
And so kind of switching gears a little bit outside of what's included in the delegation training and what the impact is of communication or poor communication, what are some of the tools or technologies or systems that Unity Health uses to stay on top of the tasks that were either delegated, whether it be through the PCT checklists or their competencies? How do these tools that you may be using help track and manage those PCT competencies and checklists?
Initially, our patient care techs receive an 8-hour in-person training session. We follow that up by mandatory training in Elsevier with specific education that's loaded into their classrooms that they're required to complete online. They must then pass a test, and then this makes them eligible to check off with our nursing staff or lab for phlebotomy skills or cardiopulmonary for their EKG skills. There's a lot of products out there, but we like Elsevier because of the educational content, and it allows the clinical directors to run reports to verify where they're at in the process and that their mandatory education has been met and that it's completed yearly. It also provides an opportunity for my clinical directors to run individual report cards in our state survey readiness.
And I think you had mentioned when we were talking earlier, you would also use that system to pull things if you were assessed by, and I don't know which board or if it was like Joint Commission or like state licensure.
Yeah, we currently use just the Arkansas Department of Health provides our surveys. We're moving to CIHQ, but right now we're with the Arkansas State Health Department. So we do use these reports to supply them.
Okay, to answer kind of their questions and surveys. And kind of thinking about the relationship building and the communication and the trust and the culture that one needs to feel comfortable to delegate a task. What kind of relationship needs to be in place for a nurse to feel comfortable delegating to other team members or specifically to PCTs?
Yeah, the closer the relationship, then the greater of a trust is going to be between the patient care tech and the nurse. This takes time. The patient care tech must earn the nurse's trust so that relationship develops and they can anticipate each other's needs, which is going to result in exceptional patient care and teamwork among the staff members.
And what advice would you give to other organizations looking to develop a delegation education? What has been the most successful outcome that you've seen on your pilot? Are there any future goals for that pilot or your delegation work? What kind of things would you share with other organizations?
My advice would be to engage the nursing staff early on in the project, allow them to help develop and drive not only the hospital policies, but your job descriptions, the patient care tech checklists. They're going to have a greater buy-in and an earlier recognition of the potential opportunities that a program like this can bring to the organization. And additionally, if you have the ability to pair a patient care tech with a nurse and schedule them on the same shifts, your project is going to move along more smoothly and that relationship will develop more quickly.
I was just curious if there's one or two most exciting things that have come out of this work.
The most exciting thing is that the nurses are re-engaged. They are excited about their jobs. They are reporting to me that they are leaving their shifts feeling like they have provided exceptional patient care, that they are getting to take care of their highest acuity patients and not feel like their other patients are neglected. They're reporting to me that the patient care techs are anticipating their needs and having supplies in the room, such as complex wound dressing changes, and it's saving them time. And our patient care techs are feeling valued.
How great. How great. And a great way to end today's podcast. We so appreciate it and congratulations on the phenomenal work. We wish you all the best in your continued success. Thanks for sharing today. Unfortunately, that's all the time we have for this edition of Knowledge on the Go. Thank you, Michelle, for joining us and sharing your insights. You've given us a lot of good information to work on. And thank you to all of our listeners for taking the time to join us today. Please join us for more Knowledge on the Go podcasts. Subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. For Vizient's PI programs team, I'm Amber Hanser. Have a great day.